This study took place at Regis University where we looked at muscle activation with surface EMG. Surface EMG can monitor muscle activation and firing frequency. Many factors affect muscle force production. Some of those include moment arm, muscle length, recruitment, physiological cross-section area, and firing frequency. There's been some research done in the area on biceps femoris and rectus femoris that show muscle length affects muscle activation. The research question was, does the change in muscle length of wrist flexors and wrist extensors cause a change in motor unit activation during maximal effort isometric hand dynamometer testing? My hypothesis was that with a decrease in muscle length, motor unit recruitment would increase for both flexors and extensors. Our subject for the study included 8 DPT students from Regis, 5 females, 3 males, with an average age of 26. Participants did not have any latex allergies, wrist injuries, or conditions. To conduct the study, 2 2-centimeter electrodes were placed on the muscle belly of the extensor muscles and 1 ground on the triceps. 2 electrodes were also placed on the flexors and a ground on the biceps. Maximal isometric contraction of the wrist flexors and extensors were measured in the standard position. Elbow at 90 degrees, 2 inches away from the body, wrist in neutral position, and grip length at normal protocol. 3 other positions were then tested, including hand grip on the longest setting and shortest setting, and wrist in maximal flexion and extension. The data was interpreted in a percent standard where the standard position maximal isometric contraction was used as the reference and all the other test data was divided by the standard. This allowed for the comparison between testers and positions. The mean and standard deviation were also calculated. The results showed that force decreased in all altered positions, with the greatest decrease in wrist flexion and extension. Wrist flexors had a minimal change in muscle activation in the different positions, but wrist extensor activation had an increase in the long hand grip and max wrist extension positions. It is important to note the large standard deviation. There was an increase in wrist extensor activation in a shortened muscle position, but no increase in the wrist flexor activation in a position. Some studies show different muscle activations occur based on isometric contraction in agonist and antagonist muscles. For example, biceps femoris as an antagonist muscle had activation levels increased with a flexed knee, so increased activation occurred in biceps femoris in a shortened position. Another study found activation of wrist extensors was greater than wrist flexors during co-activation at different angles. So the role of antagonist and agonist muscles may influence the muscle activation levels during isometric contraction and explain the greater activation of wrist extensors in a shortened position. More research needs to be done to determine this relationship. Many limitations occurred in this study, like the small sample size and the novice application and administration of EMG recordings. This can be applied to the clinic in terms of setting up the patient in a mechanical advantage, and also if the goal is to recruit more motor units, the joint position may play a role.